Good afternoon, everyone. Thank you for joining us for this session. My name is Rose McNeill. I am the Head of Strategy from Perfect Word, and with me I've got Oliver.
Hello, I'm Oliver O'Connor, Chief Product Officer at Perfect Word.
So to give you a little bit of context, Perfect Word is it's a mobile-first technology solution that allows health and social care organisations to complete their clinical quality inspections. It makes the process quicker, it makes the process easier, and it gives immediate results right from the front line through to board level and the whole way across an organisation. So we're going to talk to you today about using technology to create a culture of quality improvement. We've got a discussion forum and a live Q&A, so if you do have any questions, please pop them in the Q&A and feel free to introduce yourself on the discussion forum. And at some point during the session, we're going to have a live poll as well. I'm not sure if it's live just yet, but please do. It's live now, so please do fill in that poll at some point during the session as well. So the overarching purpose of Perfect Word and really the reason it came into being is to continuously raise the bar in quality in health and care organisations. So we're going to talk to you today a little bit about what quality is and the opportunity to use technology to improve quality and to improve quality assurance and improvement processes within an organisation. We're going to talk about some of the key elements and benefits of using technology to drive your QA and QI processes, and then a brief example case study from a customer who has taken advantage of all of the technology that's out there to drive a real cultural shift in their organisation. So the first thing I wanted to reflect on was the idea of true quality. And so there was a study in the Harvard Business Review a couple of years ago looking at true quality and really looking at the fact that the traditional top-down methods of improving quality in an organisation weren't the best way to do it. And they came up with these 4 different elements of true quality, which apply just as well to a health and care organisation as they do to any other business. And so the first element of it is that leadership need to have quality at the top of their agenda, and they also need to clearly and credibly articulate that to everyone across the business. They need to have real credibility in their message that quality is a priority and it's something that everyone should be focused on. And then the other side of it, and the part that's really important, is that the frontline staff are the ones who need to be owning that quality. And they need to feel the responsibility for that quality themselves, and also to see the involvement of their peers. They need to see their peers' success as being celebrated, and in that way, quality can be owned from the front line. And the other helpful thing to think about is the importance of good data when it comes to quality. And you may have seen the Department of Health and Social Care policy document from last month, which is talking all about the importance of data and what data can do in the healthcare environment, and the fact that easy access to that data and information is essential to help frontline staff complete their roles effectively. And one thing that is really important in engaging the frontline in quality is from moving quality from being something that's owned on high by a central quality team to something that's in the hands of the frontline, that they have the authority and the responsibility to identify and to address. And issues are going to get resolved much more quickly if the frontline staff and everyone working in any given area can identify and understand those issues immediately, rather than having to wait for their annual review from the central quality team to get that information. And different organisations are likely to have slightly different models, anything from the completely centralised through to fully democratized, only frontline staff completing that audit. But actually some hybrid of the two is really the best way to do it. So the frontline staff have that regular visibility and understanding of the standards, but then you also have the centralized team coming in to support and to validate what's going on a regular basis. And having a technology solution makes it much easier to keep the consistency across everyone who's reviewing the quality, and also to have, as the standards are updated, as the policies are updated, to have that being circulated immediately rather than having to wait to pass through multiple different communications channels. And having a really effective technology solution has a huge number of benefits on quality and on the culture around quality. And the first and foremost of that is just getting rid of those manual processes, making things quicker and easier, and freeing up staff time. And you can see immediately when you present a new technology solution to people who have previously been filling things in on their clipboard and then getting it when they've got a chance and typing it into Excel, you can see them understand how much of their time it's going to save, and it's got an immediate boost to their engagement and their morale. And another important element is having that visibility and the immediate information from the front line right through to the board. And a really good example of that is one of the organisations we work with, the North East London Foundation Trust, has an estate of 3,000 square miles. So it's impossible to have feet on the ground everywhere on all of their sites at all times, but having an effective technology solution means that staff at on the board level can see what's going on, even if they're not there, even if they're not out in those areas. And that visibility is not just from the bottom to the top of the organisation, but it also travels horizontally. So any individual area, any ward can understand what their neighbours and what their peers are working on, where their peers are really strong and they're perhaps lagging. They can go and directly seek out those peers, understand what best practice is, and implement that immediately, again, rather than having to wait for some edict to come from on high. And then the final point I'd just like to reflect on here is the shift in attitude around audit, and the shift from people thinking that they need to be at 100% or they're going to be penalised, they're going to be punished, to that understanding that the purpose of quality assurance is to improve, and the goal is not to be at 100% every single time, every single day. The goal is to be constantly identifying where things are weaker, because things are going to be weaker, but it's identifying them and being able to address them. And that is much more motivating for people, for them to be able to drive that improvement themselves. So next, Oliver's going to talk through how technology can help with some of these areas, and what that can look like, and how we at Perfect Word have started to tackle that.
Thank you, Rose. Yeah, so look, what I'm going to try to do is really talk, take some of what Rose has just covered, and really talk about what the technology solution could look like, and you know, what kind of features and functions it can have in order to support quality improvement, you know, and to support that whole quality improvement journey. I will refer specifically to Perfect Word at times, but really I'm trying to be a bit more kind of general about exactly what, you know, what these solutions should offer. So look, what I'm going to do with this first slide is I'm just going to read that statement. I know you can all see it, but I want to kind of pick out some specific elements. So what we're saying is a good technology solution empowers the frontline staff to conduct quality audits faster and capture data that is instantly accessed to make better informed decisions through data analysis. And this really sums up what we see a solution like ours needs to do. And it fits cleanly into what Rose has just taken us through. So let's consider some of the specifics from that statement. So it starts with empowerment. I mean, that's probably the central item here. Now, look, empowerment doesn't need technology. You don't need technology to empower staff, but it certainly helps. And how does it help? How is it better than, you know, kind of paper or some other kind of weaker solution? So look, a main point is that a technology solution puts data into the hands of staff, and quite literally, when you think in terms of an app designed for use on a mobile device, it is literally in the hands of those staff. It creates a direct and responsive line of communication between the front line and leadership, and it allows for a contained window on the information. So, you know, past results, other departments' results, up-to-date audits, it's all there. As I say, it's kind of in their hand. And importantly, everyone is looking at the same thing. They're all looking through the same prism. You know, the approach is really joined up, and a technology solution can really help with that. A technology solution, again, in empowering, helps overcome the confusion around what is current, what good looks like. You know, a paper-based approach to audit and sort of surrounding ad hoc training solutions simply don't provide that sort of narrowed, contained view that I mentioned before. It also provides assurance that information you add will actually end up, ideally instantly, but it will actually end up with those who can actually do something with it. And that is very, very important, again, for underpinning that empowerment, because empowerment largely is about confidence. People feel empowered when they feel confident, when they feel that they're part of the process. They then become part of the process. It's that sort of feedback loop. And ultimately, a technology solution enables a delivery and a transfer of information that supports good practice. It's not just about measuring it. It's not just about measuring how we're doing. It's about identifying where improvement can be made and then driving that improvement through. And that then drives the engagement, which in turn drives empowerment. So you've just got that constant feedback loop. And then it goes on to say here, technology promotes faster audits. And it does that simply by offering access to information and workflows that are not possible in a paper-based solution. And look, I mentioned kind of weak solutions here. I'm thinking of kind of weak technology solutions, and I don't mean that kind of in an offensive way, but something like Excel, it's probably a bit better than working on paper. But I'm talking about a technology solution that actually walks staff through the process. So for example, you can have skip logic, which is where you ask questions only when they're relevant and hiding them when they're not, so you make sure that people's focus is targeted. You can have single click responses. You can have the opportunity to add additional information like comments, photographs, other files, for example, and those things won't get lost or overlooked. You haven't got a pile of paperwork to deal with or attachments to an email and so on. It just contains everything very well, and that makes that whole audit process very, very much faster. And really, all of this, the empowerment of staff, the speedier audits that are kind of, they're not avoided by staff because they're too much work, and the instant access to information, as I said, literally at one's fingertips, really does lead the organization to make better informed decisions. It's based on up-to-date information from people at the front line who intimately understand their own environment. So the idea is it enables you to gather the best data in the most efficient way, compartmentalize it in the most effective way to review and understand it, and then off the back of that make better informed decisions. It's not you know, what's the word, like an esoteric point. It's a really kind of core thing that technology can offer. So I'd like to move on then to, I've got a slide here that shows so that's the next slide. That just shows a number of things. There's a number of core principles on which a successful technology solution will rest. And we've laid out a number of them here. I'm not going to go through every single one. We simply don't have time for it. But what I am going to do is focus on a small selection of them and describe what we've done to meet them and how we've sort of realized that piece. So I'll point out a few elements, and then, you know, I'll talk about how they sort of fit into the solution we've built, and how, you know, we aim to sort of assist in the quality measurement and quality improvement journey. So the first one is that a system should be easy to use and implement. Look, people simply, it's a really practical point about humans, and I'm one of them, and I know people don't use systems that don't make their lives easier. So we've sought to create a system that users can pick up with little or no training and get going. You know, healthcare as an environment has plenty on its plate. It's fast moving, it's not quite chaotic, but, you know, often confusing. There's a lot going on, and any successful technology solution needs to remove some of that complexity, and that's something we seek to do in the audit world. But also it needs to be easy to implement. You know, as I said, healthcare organizations have already got plenty on their plates. Complex IT systems are difficult to implement, and so look, we've built something that's easy to deploy and cloud-based. It needs to be something that can get spun up very quickly, and you'll see when we've got a case study at the end, you'll see that actually that sort of turnaround time, that implementation and go live time, can be really quite short with systems like ours. Next, the next item I wanted to look at is that information should be immediate. So look, the need for this has been made clear throughout this presentation in terms of gaining insight, in terms of giving assurance to leadership, in terms of empowering staff to actually engage in that audit improvement process. And it really is important. And it's something that a technology solution can really deliver very, very well. the whole quality improvement process benefits from immediacy here, and it's been a real focus for us, and it, to be honest, should be a real focus for any other solution. So as soon as an inspection is completed in our system, for example, it's available for all to view. As soon as you see that, as soon as that inspection is submitted, it can be viewed. And also, as soon as the inspection is submitted, notifications can go out, and this isn't just kind of notifications to help people as part of the workflow. For example, you know, you've got an action to manage now, or there's a follow-up inspection that needs to be completed, but it can be alerts like, you know, this specific question that you're interested in, some kind of killer question, like if anyone ever answers that negatively and says we're not doing it, I want to know about it immediately. Those kind of notifications can go out immediately, and that is just the sort of thing that you can do in a technology solution that you simply can't do in paper or some kind of weaker solution like Excel. So that's really important. That sort of keeping people informed is really a key tenet of solutions generally, and certainly of the solution we've built. And the next one I want to focus on is data into insights. Again, this is something that's come up a few times. So look, data without insight is simply data. It's just information. There's no point pouring information into a system like ours if you're not able to do something with it. So a technology solution really needs to turn that data into something meaningful, something useful. And you know, of course, we recognize this. So we've got a range of reporting and analysis tools within the system itself broadly, and most of them available within the app, tracking trends, identifying weak and strong areas, and so on. What we're also doing now, I mean, you know, that's good. We've got to a good point, and we, like healthcare, need to be continuously improving. So what we're now doing is really addressing what we see as a broader need to sort of analyze data at a higher level. So we're building a more extensive dashboard-based analytics feature to sit within our new web portal. It's not released yet, but it's something that we're working on now and expect to release within a few months. And then look, the point of that is to provide clear oversight, you know, give report scheduling capabilities so that you can kind of get reports at the right time and so on, and really just sort of serve that need of delivering insight to people on a plate, really, and saying that this is what's important to you. And where we're really going with that, this is our first step, is to more sort of AI driven insight, helping users to understand the data and gain insights that lead to improvement. So data insight is really, really important. I've got a couple more I want to cover. One is closing the loop. So look, it's clear that without an upshot, again, there's little point to the audit. So I've done the audit, I've identified what my problems are. You know, the process can't end there. It's the PDSA cycle. You've got to identify what your problems are, analyze them, come up with solutions, and then move on to sort of measure those solutions. So it's important that users can identify how to improve and then to own that process of improvement. So we've got action planning tools within our app, within our system, for example, that help organizations identify improvement opportunities and then manage through the delivery of those. And the final one I want to mention is that it needs to save time. I mentioned that at the start in terms of being easy to use and quick to implement and so on. And I know it's come up before in this presentation. And again, I'll say it, you know, healthcare is a busy, sometimes confusing environment, and technology solutions really need to understand this and reduce the effort. Fundamentally, it's about making sure that the system makes the life easier, because we want to empower people and engage people in that process. And if it isn't easy, then it isn't going to happen. And it's just a brute fact of the way the world works. So, for example, on average, our customers report around 60 to 80% time saving following deployment of the Perfect Ward system. And I dare say it's similar for other systems. And that is really important, because that's time back to caring for patients. That's something we really drive towards. And when I say that all of these items on this slide underpin what we do, I absolutely mean it. It is absolutely how we seek to develop the solution. And what I've done there is just identify a few that I think are sort of very important, or most important, or most interesting for this presentation. Okay, well, I rushed through all of those. Hopefully some of that made sense, but we are going to have some time for questions. So as I say, these are some key ways that we're seeking, and technology solutions should seek to assist healthcare in quality improvement. And we are, just like healthcare, continually improving. So we're going to be improving our products, and I'm sure at future presentations we can talk more about that. So look, that's all I can cover here in that short time. But if you are interested in learning more about our system and how it supports quality improvement, then look, do connect with our team on the Perfect Ward virtual stand at this conference. They'd be happy to give you a run through of the software. And now we're going to close the presentation with a short case study on the implementation of our system at a real world healthcare organisation. So it's back to you, Rose. Thank you very much.
Thanks, Oliver. So I'm going to take you through how the then Brighton and Sussex University Hospitals, now University Hospital Sussex, implemented the Perfect Word solution, and how they really solved some of the issues that they were seeing in their quality assurance programme through using technology. So like lots of different organisations, the team a bit over a year ago were facing some challenges with their quality programme. They had quite poor engagement in the quality agenda, and that was really due to some quite cumbersome processes. So they were pen and paper based, then had to go away, type it into Excel, and they had a lot of different audits that were being done across their range of clinical areas. So overall, there was quite a bit of audit fatigue, and the overall processes weren't robust. And then on top of all of that, they had the issue of COVID. So staff were completely drained, and measuring quality wasn't the priority. Their focus was obviously on patients, on that staff well-being, but there were still quality areas that they needed to be assured on as an organisation. So they really needed to energise and enthuse their workforce. And so the approach that they took was first and foremost to put the ownership in the hands of the front line, and to make sure that that frontline voice was what was being heard and was what was steering their quality programme. And so the first thing that they had to do was really give structure and consistency to what was being done across the entire organisation, and to let frontline staff steer the frequency of what was being collected, and define how those questions were being asked when they were doing those audits, to make sure that it was as straightforward and as clear for them as possible. So it was about listening to the frontline teams in the wards and the different departments, listening to what their pain points were, and incorporating all of that into the new audit programme. There was a lot of work done to rationalise the process, to get rid of the multiples of audits, and to replace it with one single straightforward tool. And then another really important point was being supportive and focusing on giving staff that space to learn and grow and get up to speed with this new tool and with this new system. And I spotted one of the questions that was coming up about the risk of bringing in another program and working with another program. But actually, what the team here and what teams across the board find when bringing in a tool, when bringing in Perfect Word and technology solutions, is it's very straightforward. And with the demographic of the workforce at Brighton and Sussex, I had lots of young staff, and making the most of technology that people are using every day in their home lives. You know, they're checking their Instagram before they come into work, and then they were putting their phones away and starting to work on pen and paper. Actually transitioning over to using an app-based solution was very straightforward and was very easy for them to do. And so some of the impacts of bringing in that solution was seeing a real change in the culture and a real shift in the culture around this quality audit. And within Brighton and Sussex, they actually went from 25% of audits being completed on time on a monthly basis up to 97%. So you can see from those numbers the huge shift in that engagement in the approach. And they also found that the deployment was a lot more quick and straightforward than they'd anticipated. So they'd actually budgeted for a 6-month rollout, and it had actually been achieved in less than 12 weeks. So they got through all of that much more quickly, because people could just pick it up straight away. They could pick up the devices that they were so used to and just complete the audits a lot more quickly and easily. Thank you. So I'll summarise there in my last minute, which was that the organisation went from having quite low morale, low engagement with their paper-based processes, through to having a huge shift in the culture and much better engagement through using their new technology solution. And so just to wrap ourselves up there, we haven't been able to get through all of the questions, but myself and Oliver will be on the Q&A later on today. We've also got our virtual stand, which you can attend at any time during the conference. And there is going to be a live demo at 12:30 tomorrow from someone in the team if you want to get a little bit more insight into how the product works. And just because I've got 20 seconds left, I'm going to have a quick look at the poll. So we can see we've had quite a few votes on the poll, and 75% of respondents are currently using pen and paper with manual data entry into a spreadsheet, and the other 25% are on a web platform. So thank you so much for filling that in, and thank you for joining us.